Section 4 expands on what you need to know in and out of the water. You'll look at some of the psychological effects that handling an emergency can have on you or others involved. Next, you'll get into specific first aid for suspected pressure-related injuries and suspected drowning. Finally, you'll learn specific techniques and considerations for emergencies with unresponsive divers in the water that you'll practice with your instructor. Any rescuer or witness who's involved with a serious accident or emergency may experience critical incident stress in its aftermath. It impairs or overcomes someone's ability to cope emotionally and is most likely if the patient ended up permanently disabled or dead. Critical incident stress can occur immediately or sometime after the accident, with signs and symptoms including confusion, restlessness, denial, guilt or depression, anger, anxiety, and it can cause behavioral changes that affect mood, appetite, personal interactions, and cause sleeplessness or nightmares. If you experience critical incident stress, don't leave it untreated. Professional counseling helps those with critical incident stress learn to understand and cope with their feelings so they don't experience post-traumatic stress disorder or other lasting emotional problems. As you recall, decompression sickness is a pressure-related injury caused by excess gas dissolved into body tissues due to pressure. Upon ascending, this dissolved nitrogen, or in tech diving it may be helium, gradually dissolves out of the tissues into the lungs. But if this exceeds certain limits, it may form bubbles in the tissues. This can cause decompression sickness by blocking blood flow and causing other damage. Lung overexpansion injuries result when divers hold their breath during ascent, or, though it's uncommon, when gas gets trapped in a portion of the lungs. Expanding gas ruptures the lungs, causing gas to enter the bloodstream as bubbles. These bubbles block blood flow and cause damage by depriving tissues of the oxygen they need. It's often difficult to distinguish between suspected decompression sickness and lung overexpansion injury. Fortunately, it's not important. Both call for the same first aid. Therefore, you refer to both conditions together as decompression illness and follow the same emergency protocols, which you'll learn about shortly. Decompression illness signs and symptoms include pain in the joints, fatigue, dizziness, extreme fatigue, paralysis, unconsciousness, cardiac arrest, and nausea. It's worth noting that the most common cause of lung overexpansion injuries is a panicked ascent after running out of air. And there are actually 4 possible lung overexpansion injuries. The first and most serious is air embolism, also called arterial gas embolism. It occurs when expanding gas forces through the lungs into the surrounding capillaries. This results in bubbles flowing to the heart and rest of the body. If bubbles go to the brain, which they commonly do, they block blood flow, causing stroke-like symptoms. However, the bubbles can cause serious damage wherever they go. Pneumothorax results if expanding gas forces its way between the lung and chest wall and collapses the lung. This causes severe chest pain and difficulty breathing. Expanding gas can also find its way into the chest cavity between the lungs, causing mediastinal emphysema. This causes difficulty breathing, fainting, shock, and blueness in the skin. If expanding gas travels up through the chest and accumulates under the skin around the neck and collarbone, it causes subcutaneous emphysema. This is marked by neck swelling, voice changes, and difficulty swallowing. More than one of these injuries can happen at once, and all are serious conditions demanding prompt first aid and emergency medical care. whether responsive or unresponsive, your priorities with a patient with suspected DCI are airway, breathing, and circulation. Have a responsive patient lie down and keep her lying down because field experience shows that symptoms may worsen in DCI patients who sit or stand. Assume an unresponsive diver has DCI. But open the airway and perform a primary assessment and give priority to rescue breathing and CPR if needed, before DCI-specific aid. Follow the flowchart on the Diving Accident Management Work Slate. The specific first aid for DCI is emergency oxygen. Have a breathing patient breathe 100% oxygen from a non-resuscitator demand valve emergency oxygen system. As you learned in your emergency first response training, if appropriate, continue providing oxygen and place a breathing, non-responsive patient into the recovery position, continuing to monitor his airway, breathing, and circulation while waiting for emergency medical care. You can give a non-breathing patient oxygenated air with the unit's free flow setting and a rescue breathing mask, but providing rescue breaths and CPR takes priority over providing oxygen. Protect the patient from excessive heat or cold. Monitor her lifeline and treat for shock while arranging for emergency medical care. You'll learn more about using emergency oxygen in Section 5 and during the rescue exercises. And you can learn more in the PADI Emergency Oxygen Provider course. Although a variety of causes trigger fatal dive accidents, in many, drowning ultimately causes death. Drowning is an incident in which someone experiences respiratory impairment due to being immersed or submerged. The most immediate sign of drowning is that the patient is not breathing. And if there's no evidence the patient has a heartbeat, the primary first aid is CPR with rescue breathing. Be prepared to turn the patient to keep the airway clear. Give a breathing patient oxygen and keep him lying down. Besides contacting local EMS, contact the local diver emergency service to begin preparations for recompression, at least until DCI has been ruled out. Sometimes a revived drowning patient feels and seems fully recovered. But symptoms can appear and worsen hours after the incident, and if untreated, can be fatal. So anyone who has drowned should receive an immediate medical evaluation to reduce this risk. As you learned, assume a diver who's floating and not moving is unresponsive. Try to get his attention as you approach. Make contact and confirm whether he's responsive. If the diver's not breathing, time is critical. If unresponsive, turn the diver face up. You can use the cross-arm technique, but anything that turns him over is fine. Drop the victim's weights to assure buoyancy. And call for help. You may drop your own weights, or retain them if you're buoyant and they give you better positioning in the water. Or you can drop them later if you need to. Remove the victim's mask and regulator, and your own if you need to. Then open the airway by lifting the chin and tilting the head. Although rare in dive circumstances, if you suspect a neck injury, use the chin lift only, and only tilt the head if it's necessary to open the airway. Look, listen, and feel for breathing for 10 seconds. If the diver is breathing normally, tow him to safety while monitoring breathing and protecting the airway from splashes. If the diver is not breathing, you will begin rescue breathing. Start with 2 slow rescue breaths and begin towing to safety, giving a breath every 5 seconds. If you miss a breath for any reason, give 2 slow breaths and resume giving 1 every 5 seconds. If the victim starts breathing, you'll continue towing and protecting the airway, but if not, assess your situation. Estimate how far you are from the boat, shore, or other place for further care. If you can, get the victim there in 5 minutes or less. Keep giving breaths while you tow or help comes to you. Get the diver out of the water. Perform a primary assessment and continue as you learned in your Emergency First Response CPR training. If it will take more than 5 minutes to get the victim to safety, give rescue breaths for another minute to 2 minutes. If the victim responds or shows movement but doesn't breathe spontaneously, continue rescue breathing while towing the victim to safety. If not, cardiac arrest is likely and rescue breaths do nothing without chest compressions. Discontinue rescue breaths in favor of speed and tow the victim to the boat or shore as quickly as possible. Get the diver out of the water. Perform a primary assessment and continue as you learned in your Emergency First Response CPR training. As with any emergency, keep yourself safe. You want to begin rescue breaths as soon as possible if they're needed, but if you need to tow the victim away from a hazard before beginning, do so. You'll learn and practice in-water rescue breathing techniques, including mouth-to-rescue breathing mask, mouth-to-mouth, and possibly also mouth-to-snorkel. Mouth-to-rescue breathing mask is probably the most effective in-water rescue breathing method and has the added benefit of reducing disease transmission risk. Pull out your rescue breathing mask as you approach the victim. After confirming you need to give breaths, move above the victim. Place the mask with your fingers under the jawbone and your thumbs on top. Draw the head back to open the airway and give 2 slow rescue breaths. Tow the diver to safety while giving a rescue breath every 5 seconds, monitoring for breathing and protecting the airway. If you don't have a rescue breathing mask or you want to start giving breaths faster, you'll use mouth-to-mouth rescue breathing. At the diver's side, open the airway by running your arm closest to her feet, under her arm, and up behind to grab and support the head by her hood, BCD, or hair. Pinch the nose and press down on the forehead with your other hand. Use your underside arm to roll the victim toward you for a mouth-to-mouth seal and give 2 slow breaths. This is called the do-si-do technique. Maintain this position and roll the victim toward you for each breath as you tow her to the boat or shore. The head cradle method may be more effective if you're significantly smaller than the victim or when wearing bulky exposure suits. Your hand closest to his feet goes under his neck with the other on his forehead. The drawback is it's not easy to roll the diver to you, so you may have to rise above the victim to give each breath. This is more tiring, and you have to be careful not to push him under. A variation on this is mouth to nose, which is suited to situations in which equipment makes it difficult to keep the mouth open, you can't open it, or you need extra airway protection in rough water. Your hand farthest from his feet goes under the neck. Then tilt the head and hold the mouth closed with the other hand and give breaths into the nose. Use your hand from under his neck to pinch his nose and, if needed, to protect the airway. Mouth-to-snorkel rescue breathing is used for towing. Note that the typical snorkel with a self-drain valve won't work. But serious freedivers and some scuba divers use snorkels without valves, so it may be an option. After checking for breathing and giving 2 mouth-to-mouth breaths, move above the victim. Drain the snorkel, then place it in the mouth using one hand to make a seal and pinch the nose. Your hand holds it against the head, making sure the tip stays out of the water. Tow the diver, giving breaths through the snorkel. With an unresponsive diver underwater, getting the victim to the surface takes priority over everything except your own safety. Circumstances will affect the best way to handle it, but here are the basics. Note the diver's condition, gear, and look for clues to what caused the accident, but don't stop to do this. Just pay attention as you arrive. It's usually easiest to raise the diver from behind. If the regulator is in place, hold it there. If not, don't waste time trying to put it back. Keep the diver's head in a normal position so air expanding in the lungs can escape. Ascend under control. You can usually do this most effectively by using your own BCD and dropping the victim's weights at the surface. You may have to vent both BCDs and dry suits, if worn, to control your ascent rate. But the important thing is getting the diver to the surface. If you have to release his weights on the bottom, or going up to get him there, or you're not sure, don't hesitate. Holding the victim from behind often works well, but this may depend on equipment, your size, and the diver's size. Any position that gives you control and positions the head normally is acceptable. If you can't control the ascent, let the victim go. The situation is urgent, but you can't help if you're hurt too, so ascend safely on your own. Regain contact and resume the rescue at the surface. As you ascend, think about your next steps based on the situation. At the surface, drop the victim's weights to assure buoyancy. Open the airway, check for breathing, and continue as you've already learned for an unresponsive diver at the surface. In some situations, it's useful to remove the victim's gear, yours or both. But you only do so if it makes the rescue decidedly more effective or faster, and think about when as well as what to get rid of. Other than dropping weights to assure buoyancy and removing anything that interferes with an open airway and rescue breathing, removing gear is normally a very low priority. When you're not far from help, removal usually slows down getting the victim to safety and additional help. That doesn't make sense. Just leave the gear on and get there. But if you have a long tow, the time it takes to remove gear may be more than offset by the speed you gain, getting the victim to safety and help faster. So, in this situation, it makes sense. You may need to remove gear to exit, but again, what's most effective? It's usually easier and faster to remove gear where you can stand or get leverage. So it may make the most sense to tow there quickly than get rid of the gear. And think about what you need to keep in your situation. For example, in a dry suit, you may find you're too buoyant to give rescue breaths effectively. So, you might dump the victim's weights, but keep your own, assuming you still have adequate buoyancy. If, after your initial rescue steps, you determine that equipment removal is the right decision, think about buoyancy. In buoyant exposure suits, you can get rid of the scuba units. But without suit flotation, you'll probably need to keep them on so you have the BCDs to provide buoyancy. As you remove equipment, keep the airway open. Give regular rescue breaths if needed, and swim towards safety. You should always have a hand on the victim's head to keep the airway open. If giving breaths, get a rhythm going, with priority to the breaths, not gear removal. Also, keep in mind that technical diving, with its extensive, often bulky gear, makes removal more likely. Many tech diving harnesses fit tightly. If you aren't sure how to remove it, your best bet may be to cut them off the diver.